So good morning and good afternoon. Welcome everyone, our colleagues, member organizations of the Swiss Water Sanitation Consortium, as well as partners to this first info session on WASH in healthcare facilities with a focus on the WASH facility improvement tool. We call that WASH FIT, and it's for healthcare facilities. WASH FIT was launched in 2018 by WHO and UNICEF. And among the contributors to developing the WASH FIT tool are our consortium member Terre des Hommes. So my name is John Brogan. I'm a WASH advisor for the consortium, and I'm working with FACET. And together with Neong from Terre des Hommes, we're really delighted to have everyone on this call. It's a wonderful occasion to explore WASH FIT, and we're happy to have Neong with us. Neong works with Terre des Hommes in Myanmar. He's a project manager of the health, WASH, and nutrition initiatives for Terre des Hommes there. And he was instrumental in getting WASH FIT introduced at the national level in Myanmar. Today, there should be something for everyone. Whether you're a WASH coordinator or a country representative or a desk officer, there's something to take away from this. At a minimum, to familiarize yourself with WASH and healthcare facilities programming and the WASH FIT tool, and then looking beyond at learning and experience and sharing that so that we can help to shape our projects as we go forward. WASH FIT is a strategic tool within our signature approach for WASH and healthcare facilities. And we're going to try and present today about how it can make a difference and how it can shift the focus from being mainly on infrastructure or hardware to actually starting with a participative analysis and planning tool that gives the health authorities and the community more agency or more say over what improvements are made, how they're made, and in a very transparent way. So WASH FIT helps to increase the emphasis on community participation in healthcare facility management, and it involves the healthcare facility staff and the health authorities. And again, that's all working toward overall health system strengthening. So if you have one takeaway from this, it would really be, if you're going to start a WASH in healthcare facilities project and you've never done it and you hear, wow, there's no water in that facility, we have to immediately just go and install a pump, and hold on a second, there's a way to get there to eventually get that water service going, but perhaps consider doing a WASH FIT process or a similar process before going right for the hardware and right for the fix. And so we'll come to the why of that. Today on the call, it looks like we have 15 participants so far. There's still a few joining in the waiting room. These are people from the consortium projects in phase 3, some of whom are experienced in using WASH FIT. For others, this may be their first time to learn about it. And we also have colleagues from consortium members who are not involved in the third phase consortium projects, but who do work on WASH programming and even WASH in healthcare facilities, and they're joining us out of interest to learn more about it. So we're really happy about that, and welcome to everyone. A few ground rules. We're not too many on the call. It's 17, maybe it's going up. It depends on your bandwidth. If you want to put your video on or not, it might be easiest to not have the video on. What we could do is, you know, we could do a brief introductory round. You could type your name and your organization, which country you're in, and you know what your role is with that organization into the chat window. But then as we go through this process, we'll be pausing at different moments to open it up for discussion or for Q&A. So at that time, you could also unmute yourself and introduce yourself. And if at any time you have questions, we'd like you to type those into the chat window so that we can keep just a watch on those, and periodically, if we can't do it from moment to moment responding to the questions, we'll stop from time to time and take the questions or the comments. Again, I think a lot of us have valuable experience in WASH programming and in WASH in healthcare facilities in particular. So yeah, we're looking at this being a more interactive session. So I'll just maybe start off in the chat. Maybe if this can be an example. So if like that in the chat window, you could just kind of introduce yourselves, and that way we get an idea of who's on the call, where you're coming from, and yeah, what your role is. Thanks a lot, Siddiqui. Great. Cox's Bazar in Bangladesh, Prakash from Terrorism in Nepal, Tigist from Hex in Ethiopia. Wonderful. Great. Annette from SRC, based in Bern. Lakshman is the regional advisor for terrorism based in Nepal, regional advisor for Asia. Satya from India. Okay. Kamal from Swiss Red Cross in Kathmandu. Ziur Rahman with Hex in Cox's Bazar. Carol from SRC in Switzerland. Great. Okay. So like that, yeah, please introduce yourselves, and then you can, again, introduce yourselves when we take questions or when you want to give some comments. Great. So I'm just going to share the screen in presenter mode. Okay, good. So maybe just the first thing we could do is just take a look at the Swiss Water Sanitation Consortium, the third phase at a glance. There's 8 member organizations in the Swiss Water Sanitation Consortium. 7 of those members have projects in the third phase. There are 16 projects in 12 countries. And there you see the members, and you get an idea of where they're working. The map there with the countries in red, we're going to adjust the red color to blue eventually, but this was just a quick mock-up for this first info session. Our signature approaches in blue schools and healthcare facilities. So there's about 140 schools across 10 countries and 13 projects, while we have 45 healthcare facilities in 8 countries and 8 projects. The objectives for today's session are, rather simple, but it's those who have less experience in WASH and healthcare facilities, that they're feeling like WASH FIT is something which is valuable and it's a viable option for their projects. So they're getting acquainted with it, but they're really starting to lean toward, let's see how we can implement this. And we're going to talk about that as well. What could be the needs of some of the projects that maybe haven't foreseen this in their project plan or in their project resources? We can start to gather those kinds of questions and see how we can support those projects to head in that direction, even if you've already started a project and you haven't actually budgeted or planned for it. And then secondly, those who are having experience in WASH and healthcare facilities, they enhance their reflection and understanding, they take something more away, they contribute, so that they deepen their experience a bit more onto WASH and healthcare facilities methods like WASH FIT. And finally, like I mentioned before, we'd like to have some clarity on which projects or members would need some special support, and potentially create a community of practice for taking this, this WASH and healthcare facilities programming and WASH FIT in particular forward as we go as a consortium with our signature approach. So those are the objectives of today's session. Maybe at the end, we can talk more about what could be a community of practice among us, how often we could meet, and what could be the next topics that we address. I'd just like to remind that there was a global call to action on WASH and healthcare facilities that was launched in 2018. There were strong statements from Secretary Guterres, as well as Dr. Tedros from WHO, looking at the critical situation of WASH and healthcare facilities. So there's a red exclamation point there, is because how is it that we arrived at 2018 and nothing had been done up until this point? Why we needed to make the declarations in 2018? I mean, there were a series of very broad studies done in dozens and dozens of countries, signaling that there are very poor wash and healthcare facility services across healthcare facilities, across countries, and it really pulled the alarm bell and got this to be a call of action. And so that WASH FIT was launched in the same year was a tool, a support for us to approach a community, to work within a health system, and try to get from point A to point B in improving services. If we just look at the Swiss Water and Sanitation Consortium, we have almost 3 years ahead of us to implement these wash and healthcare facilities projects, and you see the different teams and the different countries where we're working there on the bottom. If this is a bit of internal reflection within the consortium on what could be our strategic targets as a consortium in the third phase, it's just a small exercise. By the end of 3 years, what we would expect to see at a minimum. If this isn't happening, then really we haven't been organizing ourselves and designing our projects well enough. What we would like to see, if this happens, well, okay, we're making some good progress. And what we would dream to see for the consortium at the end of the third phase, well, there's no limits there, there's no boundaries, and we're free to dream about that. So in terms of what we would expect to see, we'd hope at least one academic partnership with a third-party research institute demonstrates that the consortium is a significant contributor to wash and healthcare facilities in the global community. That means we have some work to do with partnering, we have some work to do with understanding how we can build evidence in the project and show that, you know, from our point A, which is basically this summer, to the point B, whenever the end of the project phase is, it's different for different projects, we've made a difference and we've documented that difference and we have something to build on as we go forward. I'd like to see something which would show that, okay, we're making some results, is that if as a consortium we've been able to build evidence and we're familiar enough with wash and healthcare facilities programming, then all the projects themselves would have secured some project scale-up funding beyond phase 3. At some point, maybe if it's a project that's only having a 2-year duration within the 3-year duration of the consortium phase 3, that project would get to extend to the end of the third phase. But we'd like all projects to be able to stand on their own, all country teams to be able to stand on their own, and also raise funds to continue their efforts, having developed good relationships in the country, a good collaboration with the Ministry of Health, and good evidence to really build that portfolio. And finally, the dream to see, again, this is what's going to happen by the end of the third phase. At least 5 consortium project staff members are capable to provide external advisory services for wash and healthcare facilities. So this could be the project managers, it could be the advisors who are within those projects, it could be people who are coming on who are new to wash and healthcare facilities. But in this journey of this third phase, actually, they could provide external support to, external organizations and agencies on how to do wash and healthcare facilities. We saw a bit of that in the interphase between phase 2 and phase 3. Terre des Hommes in Mali had supported Helvetas in the region of West Africa with wash and healthcare facilities, and that was led by Abubakar Ballo, who is the wash manager for Terre des Hommes in Mali. So now, with this strategy in mind for the overall consortium, just want to propose a strategic process around programming of wash and healthcare facilities at 3 levels. Okay, so a project and a consortium, we're working at a local level, which could be at the community and the facility, also as well the municipal or district level, whichever is the case in your country. There'd be the national level to work at, and then also we're going to be working at the global level. It's our responsibility to share best practices and to really make our contribution to the global community of practice. So here, let's go through a bit of a journey in designing an overall WASH project and program. In the first info session that we had on monitoring and on the definitions of the indicators for wash and healthcare facilities, we did some recordings on these indicators and on the definitions, and those are available on the consortium intranet. But we're basing our work on the recommended indicators for core WASH services by the Joint Monitoring Program of the United Nations. So the UN Joint Monitoring Program, which is WHO and UNICEF, they came out with these recommended indicators and questions for the 5 key WASH services in healthcare facilities. That's water, sanitation, hand hygiene, medical waste management, and environmental cleaning. So this is our basis for having a monitoring framework, and this is already built into our consortium projects. In addition to that, we have a situation analysis tool, which is a little bit broader. It's looking at the system in which we're working. Terrorism has developed that in the second phase and in the third phase. And that situation analysis tool is available for members of the consortium. How we're monitoring, we've also done webinars and trainings on FACET. This is the facility evaluation tool for WASH and institutions. It's both for the Blue Schools approach, signature approach, as well as for WASH and healthcare facilities signature approach. So you can also refer to those training recordings and materials which are on the intranet. So at a basic level, we understand what we're working toward and how we would like to get there through the analysis of the situation. But again, here it's the how we get from point A to point B. Here's the cover of the WASH FIT manual, which was put out again by UNICEF and WHO. And people a lot of times ask, well, what's the difference between FACET, which is the facility evaluation tool, and the WASH FIT? FACET is taking a snapshot at different moments in the project on an annual basis from baseline to end line. It's looking at what is the situation in a given healthcare facility for those 5 different services I just mentioned. But WASH FIT, as we'll see, it's a progressive, it's a participative approach. If you're familiar with water safety plans in communities, it's like a water safety plan for healthcare facilities. And it really gets the project from point A and helps the community go from that point A to point B in a regular and cyclical process. They make WASH improvement plans and they work on those progressively. There are also tools for training on infection prevention and control. IPC is infection prevention and control. It's been really the key acronym, IPC, that has awakened the health community to the WASH community. Actually, in the years up to 2018, the WASH community could be seen as trying to chase the health community of practice and say, hey, we want to do WASH in healthcare facilities. Understanding that wasn't as readily easily as was when the WASH community started saying, we're going to try to help you better ensure infection prevention and control. So there's a tool called Teach Clean. It was developed by the Soapbox Collaborative. And Teach Clean is a process that we'll be looking at briefly later if we have time. If not, we can do another info session on it for really supporting the frontline workers, the cleaners, in doing basic cleaning and disinfection and having the right materials and equipment in order to do their job safely, which is all the more relevant in this current pandemic crisis that we're facing now. So these things happen at the local level. They have involvement of municipal and district health authorities, as well as the facility management community and the healthcare facility staff itself. Some of them are also, as you notice, into the national level. So the Joint Monitoring Program indicators, or whatever indicators are present at the national level and whatever is monitored at the local level can be shared at the national level, as well as the process of the WASH FIT. At the national level, one important thing to look at, which is present in many countries already, is a national task team on WASH in healthcare facilities. Some countries have them, Nepal has, Mali has, other countries it doesn't exist, or they're just in the process of forming them. So it's really important to start to work with that if it exists already. And if it doesn't exist, well, you can have a role, your project can have a role in forming that. And in the second phase, we saw that terrorism in Bangladesh, they approached the community of practice in Dhaka, they approached WHO and UNICEF, as well as some of the other main WASH actors. And they got some traction thanks to their consortium Global Advocacy Fund grant on WASH in healthcare facilities. They had the very first national conference on it after having done a series of regional conferences. And I should check that statement. It was both Terredism and Caritas who had that global advocacy fund together. And that led to that conference, which led to some policies and standards coming out and a regularly meeting task force. So that's an example of the difference that the Swiss Water and Sanitation Consortium has already made. And I know that there are several members who are also already active at the national level in their own projects in the third phase. The key thing here is really to identify the stories, those research questions, and potentially academic partners, both at the national level and at the global level, who can help us build our evidence base. At the global level, well, there's now a well-established community of practice for WASH in healthcare facilities. Their one-stop entry point is this website you see, washinhealthcarefacilities.org. Many of the different partners, whether it's civil society or UN organizations or others, are sharing their experience. And we're going to look and see how the Swiss Water and Sanitation Consortium can have a more formal tie-up with that. But individual members, individual projects can already start to share your materials and your learning. But the consortium itself and our knowledge management team will be also charged with collecting and gathering that information, making some stories, making some key briefings, and sharing that at the global level. So that's just the tour of a proposed programmatic strategic approach for a given project in a given country, some things to keep in mind. I'm just going to check the chat window and see if there have been any comments or questions. I don't see any for now. We did speak about the FACET, the facility evaluation tool, which was developed by Terredism and EVAG with the technical support of Carto-NG. And so just a slide on that, this gives very easily collected data on a mobile data collection tool device with ready graphs that help you to explain the situation in your healthcare facility and also help you to show between two data sets what's been the change. Now I'd like to come to the WASH FIT tool. So again, we mentioned before, this was the risk-based continuous improvement framework that's tasked with improving healthcare facility conditions, and it's based on WHO standards for WASH in healthcare facilities. It's really focused on improving the day-to-day management of a facility. So again, going beyond just installing the infrastructure and making sure it's functioning, but how is that whole process of installing the infrastructure fitting into a broader scope of programming on WASH in healthcare facilities within a community? It encourages a team-based approach, so teams made up of healthcare facility staff, of community-based leaders and community managers, as well as local authorities. It helps to identify areas for improvement and gives a framework to monitor and continuously implement and plan for these improvements. We could say what it is. It's definitely for facilities to use internally, and they prioritize and they maintain their WASH improvements and they focus on actions. It's for infrastructural changes, for maintenance and repair. It's also for behavioral changes, such as hand hygiene behavior, things that you're observing are not happening, how to set it up so that you could observe that they happen in the future. And it's comprehensive and systematic. Again, it's about going from point A to point B, not just about doing an assessment of the facility and seeing the situation. It's not, as we'll see in the next few slides, a one-size-fits-all approach, nor is it an exercise that can be completed in a day. This is something that takes place over time with different moments of seasonal aspects and work. There's a process. It's outlined here. This is a snapshot from the WASH FIT manual. The 5-step process involves assembling and training a WASH FIT team, and that they hold regular meetings. So these could be meetings every month, every 3 months, but they would go through a process. And as we mentioned before, the WASH FIT team really needs to be made up of movers and shakers within the community, members of the healthcare facility staff, ideally someone from the district or municipal level, a WASH authority or a health and water authority, as well as members of civil society. Together, they conduct an assessment of the facility, an assessment which is based on indicators which have been pre-agreed. And the assessment needs to be contextualized to that country and usually to that region. So we'll talk about that in a little bit, but keep that in mind that there's a contextualization process of the WASH FIT manual and the survey which would take place. Based on that survey, they go through a hazard and risk assessment in the third stage, and they note which areas that need attention, how serious are they, how urgent are they. And based on that assessment, they develop an improvement plan, and they implement that improvement plan, and then they meet regularly and continuously to take a look and to evaluate how that plan is going, and then to go back and do some other surveys. So perhaps they don't need to do as in-depth of a survey as the step 2, the assessment of the facility every year, but at least they could be doing some FACET surveys, which are maybe shorter and easier to implement just to see how they're doing. But again, it's up to the team to decide how often they should do that assessment of the facility with the WASH FIT indicators. And that's something we can hear from others who have experience in using WASH FIT as to what they've decided in their countries. So this is just a brief overview of the 5-step process. Again, it looks similar to a water safety plan exercise for those who are familiar with it. And it's available at the website you see on the screen. I should have mentioned that this presentation and the recording will be made available following this info session. Now let's talk about contextualizing WASH FIT. I'll just present a few slides and then we'll pass it on to Neong, who will be giving us a snapshot of his experience and his team's experience with Terre des Hommes in Myanmar on introducing WASH FIT in Myanmar. So when we talk about contextualizing WASH FIT, there's a really wonderful example from Mali that happened a couple of years ago. It was a collaborative effort between the government of Mali, the Ministry of Health, WaterAid, and One Drop, with funding from the Hilton Foundation. So we mentioned the 5 steps, but actually there was a step 0. And what they did with their step 0 was do a national level orientation and partnering with the Ministry of Health and look at how they would contextualize WASH FIT according to the standards and policies for water and health that were in place in Mali. So what that means, if you look at the WASH FIT manual, the one that was published in 2018 by WHO and UNICEF, there are some 70 indicators that could be measured. And some of them are relevant or more relevant or less relevant for a given context. And the leadership in Mali decided that based on their context and their situation, their priorities, and what was feasible, the government selected around 30 to 35 indicators for that particular survey and as indicators to take the WASH FIT process forward. So once they had gone through that process, then was next to form the WASH FIT team. So again, these are district hygiene authority members, staff, community members, and it's just to list them out, who's present, and to agree how often they're going to meet and the steps that they need to take. We'll hear from Neong a little bit later about what it took to really put that team together and to get them working together and understanding the WASH FIT practice. The next thing they did was they did the survey. So in step 2, they did a broad evaluation of the indicators according to the domains. So in WASH FIT, there are domains. We talked about WASH services, 5 WASH services. Those WASH services are there. They're called domains because they're also including some of the environmental conditions and also the way that the facility is managed, which management of the facility and the general environmental conditions is not measured by the FACET tool, nor is it commented on by the JMP guidelines. So here you see, I believe in the original WASH FIT manual, there may have been a dozen or 2 dozen indicators for water. Here, the domain for water has 8 key indicators that the government of Mali said, yes, this is what we want to capture. So you see in the column, there's the indicator itself, and then there's a stoplight approach. If it's meeting the target, partially meeting the target, or not at all meeting the target. And so then there are different ways of grading that. But what the project did, the One Drop project with WaterAid, they decided to design these indicators into visuals to better connect with the community. And this had a really good effect with the team, the WASH FIT team in a given healthcare facility. They would see what it means when we go from these indicators, what are we looking at? What do we want to achieve? So this became a visual that not only inspired them, but also could give them a bit of an interface with the rest of the community as to what they were trying to achieve. And similarly, they did this for sanitation, what they were looking at in terms of the maintenance of the sanitation, that there were sex-separated toilets, that there was disability access, that there's a hand washing station close enough to the facility. Hand hygiene indicators, the government chose 2 of them, that there's a presence of a functional hand washing station in all the rooms, in the yard, and in the waste management areas, and that there were clearly visible posters to promote hand hygiene in the key areas. So these were the 2 main indicators that the WASH FIT process in Mali decided to have those teams evaluate. Similarly, for medical waste management, you see it was very important to have the 3 different color bins that were labeled, that were covered, some personal protective equipment, incinerators that were of a certain design, and soap on premises. In terms of the environmental management and the facility management, you can see the images that were used so that there's adequate lighting, there's good spacing between the beds, there are working mosquito nets, it's a clean area. And then for facility management, the infrastructures are there, they're functioning, but there's also regular meetings, and there's a certain dialogue which is happening on this WASH FIT process, and it's regularly updated. So here, again, this is a way to tell a story, to transmit the intention and the aim of the WASH FIT process in a way which connects better to the team as well as to the community around. The third step involves looking at what was assessed, looking at the key aspects that need improvement, and grouping them into a risk, a hazard risk assessment. So here on the right-hand side, you see for this, this is a given example that comes directly from the WASH FIT manual from WHO and UNICEF. They saw that the lighting was insufficient in the latrines. There's no wash budget. The waste burial pit is very full. There's no piped water system, no hand hygiene station. So like this, they recorded the key aspects of what they see are critical issues to address. And then they grouped them in this quadrants. So the higher the risk and the more difficult to address were here, and the lower the risk and the easiest to address were here. And then this, they can factor into their WASH improvement plan. In the improvement plan, there are several examples of it in the manual. We don't have an example here to see, but it's just basically a list of activities. Which activity is going to be done by whom and by when? And then that's something which is followed up every month with monthly meetings, or every 3 months if the district authority can come and look at and help manage the situation of the improvement process. In some areas, they may say, wow, these risks, which are very difficult for us to address, we may need to get outside support for it, whereas with the lower risk, we can take care of that ourselves. In Mali, Terre des Hommes had really good experience without providing any outside funding or support, but having gone through a WASH FIT process, they saw that communities automatically drafted job descriptions for cleaners. They increased cleaning staff, number of cleaning staff in some facilities because it wasn't adequate. And they also saw some healthcare facility management communities building new toilets and building new latrine blocks because they had the resources to do it and they didn't want to wait and try and get funding for it. They preferred that that funding would go towards something like a piped water system. So now I'm really pleased to pass over to Neong. I'd just like to say that we did share this, this brief that Terre des Hommes team had put together in November of 2019, and thank you to Neong and the Terre des Hommes colleagues for sharing that with us. It's a really wonderful resource within the consortium. We do have another one, which is in French from Terre des Hommes in Mali, which was co-edited by one of the cantonal cooperations in the Canton de Vaud in Switzerland. And it's also talking about their experience with the WASH FIT tool. That's available in French. So Neong, I'd like to pass to you. Please unmute yourself, and I'll be happy to scroll through the slides as you go.
Okay. Thank you so much, John. Hello, everybody. I'm working as a project manager for Terre des Hommes Myanmar. Now I'd like to share our experience of working on WASH FIT in Myanmar. So next slide, please, John. Okay. First off, I'd like to introduce our project briefly that we implement using the WASH FIT tool in 2019. And we implement the project in like the township. This is a very urban with nearly 1 million population. And we implement this project with the government funding for 1,000 Swiss francs for 1 year. We target 7 primary healthcare facilities, of which 2 urban health centers, 1 rural center, and 4 sub-rural centers. We implement this project in close collaboration with the township department and also technical guidance from the Yangon Civil Development Committee, YCDC. We have 2 components. The first one is soft component. We use the WASH FIT and teach clean for the soft component, and for the hard components, we provide for the construction of the WASH infrastructure for the WASH and healthcare facility. So we start the introduction of WASH FIT. I mean that we received the introductory on the WASH FIT by a webinar in March 2019. That's organized by Ratio and TDH. In April 2019, we have received a WASH FIT guidance and WASH FIT manual from our headquarters TDH. Then we have to learn and study WASH FIT, how and why it is implemented. Then we prepare the training curriculum for the project step on WASH FIT in June 2019, and in August 2019, we organized a WASH FIT contextualization workshop with the participation of all key actors from national, regional, and township level actors. This project is ended up in March 2020, but starting from the April 2020, we continue to promote the WASH FIT project with the funding from the Swiss Water Sanitation Consortium. So John, next slide, please. So WASH FIT introduction advocacy process. Firstly, we met with the national director from the WASH division, and the minister had a spoke. We introduced and advocate about the WASH FIT, and then we also met with the regional WASH focal point and authority to introduce and advocate about the WASH FIT and our implementation plan in the line of adoption. Then we met finally with the township department, township medical officer, and the healthcare facility in charge. We also met with the township level YCDC, WASH focal point, and authority, introducing the WASH FIT, our process of implementation plan in this township. So this is the process of how we start introducing and contextualizing the WASH FIT in Myanmar. Then we organize the workshop with the representative from each department that mentioned above, of the stakeholder, national level, regional level, township level, and also some health center in charge and staff from each HCF to review the WASH FIT and to contextualize the indicator all together at the workshop. We review the indicator and we select the most relevant indicator from Myanmar. Next slide, please, John. After the contextualization workshop, then we have done a lot of series of activities like the establish the WASH committee at the HCF level. We are now forming the new one, just the revitalizing from the existing healthcare facility committee. Some members, almost all members are selected from the existing committee. But we need to discuss with the healthcare center in charge to be more, the person who can actively involve and participate in our process of implementing the project, because some of the HCF committee members are just lists, so they are even not coming to the HCF regularly. So we need to be careful about the selection process of WASH committee members. We need to discuss with the health center in charge. Then we organize a WASH training for those WASH committee members together with the HCF staff and the HCF in charge. Then we start the reviewing the indicator, and then we take the assessment, analyze risks and hazard in the regard of WASH and HCF all together with WASH committees and also health center staff. Then we record and document the work and finding of those assessment and analysis we did. And depending upon the findings, we prioritize the text. We prioritize the text. I mean that WASH committees and health staff, they have to prioritize the text. WASH are to be WASH are to be included in the improvement plan and the implementation process. Then, depending upon the finding, we develop the WASH improvement plan for HCF. So that's all. This also done by WASH committee members, health center in charge, and by the facilitation of DDH staff. And then we share the responsibility. Then we share the task and responsibility for the implementation of improvement plan between WASH committee, township department, and territory. Then we start implementation of the activity as per the improvement plan. We also conduct the quarterly monitoring and supervision visit jointly with the township department. And we also have a review workshop with the WASH committee quarterly on where we are and what we have to do next, etc., etc. Next slide, please. So this is a result what we have to achieve by using the WASH FIT tool. All the HCF have developed the WASH improvement plan. So the 7 HCF already have the improvement plan for the respective health centers. So they develop the improvement plan depending upon the findings and priority of each HCF, and then share tasks and responsibility among the township department and the HCF committee and the DDH who what to do for the implementation of the tasks and the priorities. Most of HCF have improved the work services. 2 urban centers, primary and secondary urban center, they have improved. They have already improved the work services. 1 rec center and the 2 sub-rec center. In the regard of the annual WASH fund, 3 HCF have already established the annual WASH fund. So for instance, the secondary urban center, they have the 200,000 mmK for the WASH maintenance, for the operational maintenance of the WASH infrastructure. For Kalajisu sub-RSC, they have the 100,000 NMAJAC. It's roughly around 75 USD per year. The last one is Australian Mass Breast Center. They already have the 170,000 NMAJAC. That's around 125 USD per year. So this is what we achieved in 2019 and 20 March. And the fourth one is improve community engagement in WASH. This because we implement the project using the WASH FIT tool. So the WASH committee members, they lead and help in cleaning up latrine and HCF environment. They themselves the repair basin and pipeline. They also involve in site selection. They also have involved. They also involve in monitoring process on the construction that's done by the contractor. So the WASH committee and some other committee members, they have involved in the implementation of a project. The last one is committees improve knowledge on WASH practice. At the beginning of the project, the committee members not much. They don't know much about WASH and HCF. For instance, if there's a basin, they think this is enough. But we have checklists. When we have the checklist. When they saw the checklist, oh, this is very comprehensive. So they clearly and deeply understand what are the WASH situation and WASH FIT by looking at the indicator of the WASH FIT 2. So they know about the minimum standard of WASH and HCF and co-function of the WASH domain and ONM measure, operation and maintenance measure for WASH infrastructure and hand hygiene practices. So etc. They got clearly understanding on WASH and HCF. Next slide, please. So this is a comparative research that we did for the baseline and midline. So for the water, all the HCF have the basic services. For the sanitation at the beginning of the project, 6 HCF are limited services, 1 HCF no services. At the midline, 1 HCF offer business WASH services, sanitation service. 6 HCF are still limited. For the hand hygiene, at the beginning of the assessment and project, 3 HCF have business services and 2 HCF are limited and 2 have no services. But at the midline assessment, 6 HCF already they can deliver the business services on hand hygiene. Only 1 HCF are still limited. For the waste management at the beginning of the project, 4 HCF are limited and 3 HCF are no services. At the midline assessment, 3 HCF could offer the basic services on waste management. 4 HCF are still limited. So I look at this result of the midline survey. We still need to try to promote and to continue working on the WASH FIT together with the WASH committee for the HCF who are still limited services to get improved to the basic services. So we have to continue working on the HCF could offer the basic service on water, sanitation, hand hygiene, waste management, and environmental cleaning. So we will be doing with the funding from the Swiss Water Sanitation Consortium for 2020 and 2021. So this is our plan for this assignment HCF using the WASH FIT 2. Next slide, please, John. Okay, these are the success factors. We for influence assistance, we need to have the evidence for the positive change with the FACET. And we also need to document all the process of contextualization and agree indicator in the local language. members of Montreal from the WASH committee and HCF to share their experience with the authority, especially for the policy and advocacy purpose with the national level authority. We need to invite the Montreal of members from the WASH committee and HCF. They can share their experience of working with WASH FIT at the national level advocacy for the WASH FIT. And we also need to participate in the cluster meeting and the info sharing meeting with the WASH Center at the national level. We also need to make sure that supervisory fixes from the regional and the national level, because most of the regional level and national level staff and officials are quite busy, so they cannot pay like the supervisory fixes to the field level. But we need to make sure they provide the supervision fixes to our project sites, so that they can understand what are the WASH FIT and how it's implemented in the field level. We also need to organize a national level coordination and workshop for the policy efforts and they apply the WASH FIT as a tool for the implementation of WASH and HCF. Next slide, please, John. Next slide. Okay, these are the suggestions for the others members. WASH FIT training. We need to receive the WASH FIT training. We need to provide the training for the project staff, including the regional WASH focus point, because even myself also received the introductory webinar on the WASH FIT. Then I have to learn the WASH FIT guideline, then have to apply for my project implementation. So it'd be good if we could receive the formal training or informal training on the WASH FIT, maybe sharing from some other country who have experience of WASH FIT implementation. And the second one is the proper planning. We need to have proper planning for the WASH FIT advocacies and contextualization, so that all the key stakeholders clearly understand what is WASH FIT and how it's implemented. And key actors like the downshed officer, supervisor, head staff, WASH committee member, they need to understand clearly about WASH FIT and its process, because they are the key focus person who will be deeply involved in the implementation of the WASH FIT project. So if they don't know clearly about the WASH FIT, that's very difficult to proceed the process. So we need sound facilitation, mobilization skill to facilitate the process of WASH FIT implementation with the committee, in addition to the WASH technical. And the last one is the selection of WASH FIT committee members. I already mentioned earlier. We need to identify the active and dynamic member from the existing clinic committees, because some of the committee members are just list a name in the list. But we need to select the active one in collaboration with the HCF in charge. So these are our experience in the regard of WASH FIT implementation. So thanks for your times. Any question?
Thank you very much, Neong. That's a really solid and convincing presentation, not only of the results you were able to achieve in going from no service to limited, or limited to basic level of service, but also in the involvement of the people. And we do have a first question from Siddiqui in Cox's Bazar. Thank you for that. And if anyone has questions, you can type them into the chat window, or comments, or complimentary information. So Neong, Siddiqui is asking, since you have used WASH FIT tool in both primary and secondary healthcare facilities, he's interested to learn the process you adopted, the generic tool for the secondary healthcare facilities. So I think the first question is, just to be clear, was it also a secondary healthcare facility that you implemented in, not just primary healthcare facilities? And did you use the same tool for both of them?
And actually, all the 7 healthcare facility are the primary healthcare facility. Here, what we name is the secondary urban center and the primary urban center is named by the township department. Actually, they are just the urban center. So we use the same tool for this urban center because these are the just name primary, secondary, not the that doesn't mean the level of health center. So on the A7 HCF are the primary health center, primary healthcare center. So we just apply the same tool.
Okay, thank you very much for that. If anyone on the call has experience in adapting WASH FIT between primary and secondary healthcare facilities, please raise your hand or mention this in the chat and we'll come back to you, because that's a very good question. A question from Prakash from Terrorism Foundation in Nepal, appreciating the presentation and asking how many members are there in the WASH FIT committee in Myanmar? What's the overall composition? Are they meeting regularly? If yes, how long? What did the project support do to make that happening, to get them meeting regularly, or is the project still accompanying them? And then also if you have any key challenges in implementing WASH FIT based on your experience. So maybe we go one by one, Naeong. This is a good package of questions from Prakash. Thank you, Prakash. So maybe the first question is, how many members are in the WASH FIT committee in Myanmar, and what is the overall composition of a given committee?
For us in Myanmar, we just only comprise of 7 to 9, maximum 11 committee members. Roughly, it's just about 9 committee members for each HCF. Yes.
Okay.
Yeah.
And the composition?
Positioning is, how does it mean overall composition?
Meaning like who is joining, like what, from what area, what is the background of the members?
Yes. The key person have to be the head staff from the respective HCF. Maybe 2 or 3. It depends on the number of head staff of each HCF. And the rest are from the community members, like the ward administrator and the head household leader. In some areas, our mother support group members, they involved in the WASH committees.
Okay,
so,
great.
Yeah.
And then how often are they meeting?
Normally we have meeting on monthly basis. Sometimes if needs for one HCF, we met 2 weeks. We have 2 meetings per month. So it depends on the what state of HCF are there. So yeah, normally it's a one per month.
Okay. And do you get the feeling that those meetings are happening whether or not terrorism is involved?
Yes, we have to involve in the meeting because we have to facilitate the meeting because the WASH FIT is not much familiar to the committee members. So we better involve and facilitate the meeting.
Sure. I guess with a 1-year project duration, it's not easy to get those committees going, but maybe over the course of the next 2 years, that could be something which is considered for how to get them meeting independently and how to set that up. So they're taking more of the lead.
Yeah.
Any other challenges for the implementation of WASH FIT that you'd like to share?
Any other challenges like to organize the meeting with the WASH committee members? Not all members are free. And they are not available to join the meeting. So we have to adjust the time date for the meeting. This is one of the challenges we implement the WASH FIT. The second one is the interest of government township department, because township department, I mean the township medical officer, she is very busy. So we need to organize it. We need to push the township department to have a watchful care at township level. So they are busy. They cannot join with us on I mean, they cannot drive regularly on our monitoring business to the HCF.
Sure, yeah, that's, maybe it's involving them at given moments in the year, but not in every single meeting. That could be one way of looking at it. Prakash, do you have anything else you'd like to add or ask, since you have the floor, if you'd like?
Thanks. Thank you, Naeem, for the answer. Don't have further question.
Okay, great. I think there's another question from Annette. So Annette is wondering, how did the government support the approach? Did they also contribute to the budget financially? Did you use a matching fund approach with the infrastructure improvements and the activities? I think that's the question.
How did the government support the approach? And the government, not the government, I mean the WASH division and other MOHs, they involve and provide their input for the contextualization of the WASH FIT. This is from the national level, inputs, and also from the regional level. But for the budgetary, I mean, for the financially supports, it does not support the financially for the WASH FIT implementation. But the township department, if they have the annual fund on for their township department, they share some to the HAC center. So I don't know exactly how much budget they share to the HCF annually.
Okay, and any of the improvement works that were done, was there any matching fund provided by the township department? Or was it all the project that funded that?
And so far for the hardware infrastructure, the TDH supports for the development of the hardware infrastructure. Because TDH is supporting on the WASH and HCF, the township department only protects and focus on other areas, not on the WASH, like the renovating the medical store or something like that.
Okay, okay. And the budgets that were put into place in those 3 healthcare facilities, how did that happen? How were they generated?
Yes, the committee members, they how can I say, they donate some money for the HCF. In some healthcare center, the administrator, they have some donation from the others company or the factory. So they also use that money donate for the HCF for the work sector annual fund. Yeah. Okay, thanks, Naeung. I just want to come back on Annette's question. I know that the team in Nepal, maybe Prakash, you could help us out with this. Now there's a new municipal system, and in going forward, are there some matching funds which you're looking at in your WASH and Healthcare Facilities project to do infrastructure and getting contribution from the municipality in Nepal?
Yes, Son. We are working with the municipalities, and definitely we're looking for the funding definitely from the municipalities. But as you know that it's not that easy. But definitely the situation has been improved, and then now the authorities are there. They are convinced actually. We're getting good response from them.
Great, thanks. I would like to share one experience I heard of from Terre des Hommes in Mali, where the team there, they took the results of their FACET survey, and they did they called for a meeting with members of the healthcare facility management committee, those members of the WASH FIT team, so that they could present to the municipal leaders about the situation in the healthcare facilities based on what they found. And they invited the public to that meeting. And so as part of their local level advocacy, they apprised the local government of the situation. And that created a dialogue where the local government agreed to start funding and start including a budget line for WASH and healthcare facilities improvements. Now, I haven't heard the final aspect of that story, what actually was budgeted and what actually made it to a healthcare facility in terms of improvement, but that's definitely a story we'll be following in this phase. Annette, any other questions or anything else you'd like to follow up on with that?
No, thank you, John. That's fine. Thank you.
Great. I think the next one is from Tulasa Baratti. Thank you for the presentation. Was there any contradicting policy guideline used from Ministry of Health stakeholder working in the health to improve the quality of health in general? Tulasa, I'm not sure I got the question. Could you just unmute yourself and ask it? The contradicting part I'm not really clear on.
Thank you, John. When heading the Myanmar.
Oh, sorry, it's very faint. Can you speak up, please?
Yeah, I'm just wondering. In general, there are so many organizations like the Ministry of Health working and developing different guidelines and policy to improve the quality of healthcare services, so which also includes some aspect of the WASH as well. So while we are implementing this this tool, was there any contradicting idea or kind of any difficulties to come up in conclusion while contextualizing these tools? That's just wondering to know.
That's a really good question, especially as we see a lot of governments coming out with infection prevention and control guidelines, and this could be seen as something auxiliary to that. Neong, did you have any experience with that?
Yes, we also have to reference the national policy and guideline on the WASH and HCF, for instance, the infection prevention and control, and also the national policy for water supply and standards. So that's developed by the Minister of Health in collaboration with the UNICEF. So we have to reference and we have to apply the relevance and the relevant sector and section in line with the national policy and the guideline.
Very clear. So the WASH FIT contextualization had to take into account those other health policies and guidance notes.
Thank you, very clear. Thank you.
Thanks for the question. Satya is coming on. Satya, would you like to unmute and ask your question?
Thank you, John. Yes, so Nat, thank you so much for your good presentation and the good work you have done. A couple of questions I would like to understand your experience better. One is, now the HCF authority have adopted WASH FIT, and in that process, so when they try to ensure the regular operation and maintenance of the facilities, did you see that they have faced any difficulties to fund that requirement? So number one. Second is, did they follow any tool to arrive to the figure, the budgeting figure that they require for budgeting the operation maintenance cost? I mean, did they use any costing tool?
For the budget on the O&M, some of the HCF, the 3 HCF, it depends on the leadership of the health center in charge and the cooperation of the water authority. So for instance, the 3 HCF, they have the funding. The fundings come from their donation, individual donation, and the water authority, they also refer the donation from the other factory and community, from their wards or villages. So it depends on the leadership of the health center in charge and the water authorities cooperation. For the REX, for HCF, they start struggling and start thinking about the annual WASH fund for the O&M. So what could be the best way for the HCF to have the annual WASH fund? So in that cases, TDH has to facilitate to have the annual fund. So to find a way for the collection of the WASH annual fund, maybe they got from the township banner, or maybe they donate individually, or they request to others, maybe water authorities or some other companies or factory. Yeah, So I think it's depend on the location, it depends on the HCF and their leadership and the water authorities cooperation.
Okay.
Thanks, Naum. Satya, can you share your experience about the costing tool you asked about, and
Yes.
maybe how that's relevant in this scenario?
Yeah. So in my experience, what I have faced in different phases is that when any authority or anybody adopt a WASH FIT such management tool, one of the problems they face in the process of adopting or continuing with that is that what is exact the budgeting amount they need to allocate for operation maintenance and long-term sustainability of any infrastructure. So now they are committed that they would operate and they would meet the preventive maintenance, repairing and replacement of the facility. But how much would they cost? So that is where the problem they face. So therefore, there are WASH sector player globally. They came up with some costing tool, which is called at what cost. So that helps the authority or the practitioners to arrive at what is exact amount they should be budgeting for year 1, for year 2, year 3, and so on, so that they can actually block the money that would require for 3 things. One is the preventive maintenance, second is minor repairing, and third is major repairing and replacement, because some of the parts of a water system would expire after a certain period of time. So therefore, it is very important that the increase in cost or increase in price of that product should be considered, and also budget a sufficient amount so that you can meet that repairing cost. That is what I wanted to understand, Matt, from you, that was there any tool that was guiding the authority to arrive to that exact operation maintenance figure that they need to budget. The second questions I have, John, if I, can I go to the second question, John?
Sure, go ahead. Sure.
And now the another difficulties I have seen in my career is that when we establish any such committee in any government department, so there is a retirement of the member happens. So therefore, in the process, it is very important that the legacy or a process is established, so that whenever the new member coming in or the existing member is retiring, the new member are actually capacitated and they are brought in. They are brought into the role very actively. So now, Nat, was there any such component in your process so that if any existing member of the WASH FIT committee in HCF authority retire, and then if the new member coming in, who is going to train them and how this training, so whether they would always require you to go and train that new member, or the existing members are a kind of expert as well to train the new member coming in?
Thanks, Satya, for your question. For Myanmar, to answer your second question, on the train on WASH FIT for the new coming members, so far we still continues the WASH FIT project, I mean the WASH project, WASH HCF project with the funding from the Swiss Water Consortium. So we also have the budget for the WASH FIT training for the WASH committee members, so we can provide in the project and the project duration. So that's a good question. We also need to think about the sustainability of the WASH committee members and the training for the new members who come in. So that is the another area that we need to think about when we are in 2021. We are close to the face up. Yeah.
Yeah, thanks for that, Naong, and also Satya for your line of questioning. Very relevant. I think you have mentioned this at what cost tool or method. That'd be great if we could get that and make that available to our now forming community of practice, or get it up on the consortium website. And any other insights, maybe that's a collaboration we can have, guidance you might have on how to facilitate when there's a certain rotation in the committee, and how to make sure that there's a way for onboarding new committee members, like you're saying. So maybe that's something we could look at in a future session, and also put together some guidance note on that. I'd like to come up. Tulasa had a question, and then there's a couple colleagues from Nepal who would like to share on the experience of Nepal. Tulasa, could I come back to your question about the major criteria for the selection of the healthcare facilities? And I think Naeong, the question is about, was there any link with service utilization? Tulasa, would you like to just elaborate on that a bit, please?
I think it's, I just want to know what were the criteria to select those health facility where we implement the project. I mean, there might be so many healthcare facilities within the geography that we are working. So how did you come those number of health facilities to implement the project? And in the presentation, I have seen that there is improved in the different aspect of the WASH. And I just wondering whether there is also kind of any linkages of the increase in the service utilization after having improved WASH in that particular health facilities.
Okay, is that meaning the improvement of the services has led to more users and people seeking treatment or care at these facilities?
Yes.
Good question, thank you. Now?
The major criteria for the selection of the health facility. Yes, so far we just focus on the primary healthcare center, and the WASH FIT guidelines also guides. This WASH FIT guidelines also primarily aim for the primary health center, primary healthcare center. So far, that's just where we implementing in the primary healthcare center. So that's no problem. If we like to implement like the secondary or the tertiary health center, we need to adjust contextualize for the secondary and tertiary level health center to use the WASH FIT tools. And the second,
Naeong, on that note, but the 7 that you chose, those 7 primary healthcare facilities, what was the criteria for even selecting those 7? Maybe there were others that you could have selected.
In Lantaya, there's 10 healthcare facility. One is a township hospital, and the second one is the station hospital, and the third one as a 10 healthcare facility in the Lantaya township. We only focus on the 7 healthcare facility where which are the primary healthcare center.
Okay.
So the rest 3 is, the first one is township hospital, we are not targeting, and the second one is the station hospital, we are also not targeting, and the third one is the center, SWSC center, where there's no building. So we exclude these 3 health centers for the implementation of the WASH FIT.
So you wanted to cover the whole township and all of the primary healthcare facilities in that township.
Yes,
Thank you, that's clear. Okay.
Yeah.
And the second question on whether you saw any change in patient numbers or people seeking care at the facilities before and after the implementation of the improvements?
Yes, I think we can also compare the sample utilization of the HCF with the baseline survey and the midline survey, because we have the data on the outpatient consultation of each HCF. So yeah, I think we can compare the sample utilization rate at from the baseline and the midline.
Okay, great. That'd be really interesting. Of course, there could be many other factors involved with the increase or decrease in number of patients, but maybe some other qualitative information could be collected on that to polish it out. Interesting. Thank you for your questions, Tulasa. Is that okay for now? Is that answering?
Yes, thank you.
Okay, great. Thanks a lot. I'd like to go to Nepal team, both Lakshman. Well, Lakshman is part of the regional Asia team. He's the WASH advisor for terrorism in all of Asia region, but he's based in Kathmandu and having a lot of experience in Nepal. Lakshman, any thoughts on this?
Yeah, I think there was a point just related to sustainability. We talk about sustainability of WASH in healthcare facility, but this is about the sustainability of the WASH FIT processes itself. We found an opportunity in Nepal. Now the municipality WASH plans are being prepared. So we got the opportunity of working in some of the municipalities. When you reviewed what we found that their indicators, when they do the assessment of coverage in the beginning, their formats for WASH in the community, WASH in schools are very nicely developed. But it was very poor in case of WASH in healthcare facility. So we saw a very good opportunity of using the what we are using in WASH FIT in a way. If an opportunity to mainstream sort of our WASH FIT experiences, so that if these are embedded in the policy, so this will be the WASH FIT process could be more established. It may not, it could be in the similar with the similar indicators, or it may be a adapted form. But there's a nice opportunity for mainstreaming these indicators or what are or factors we are using, or the process even. There's a nice opportunity because WASH in healthcare facilities is not yet developed. That was the point I wanted to raise in relation to the sustainability of WASH FIT, towards which we are working. Thanks.
Thank you very much, Lakshman. That's very spot on. And making use and taking the opportunity of the new system in Nepal to see how to best support the authorities as they're coming up with policies at that municipal level. Great example. Prakash, also in Nepal, I see you have your hand up. Yeah.
Yes, yes. Basically, I have one question, one sharing. Basically, in our recent meeting to the recent visit to the project site, we had we got an opportunity to interact with the WASH FIT committee member, and where they had shared that that now they have been able to advocate with the municipality authorities for the allocation of fund on the basis of this plan that were developed with the support from the TDS funded project. I think this is I think good signs that now they have something on the basis of which they have been able to advocate with the municipalities. So this is what we get feedback, like response from the WASH FIT committee member, and we are taking it very positively. And the second, actually, I have one question, a quick question for Nang regarding the continuation of this WASH FIT committee meeting in future. My question is basically, it is because usually what happen with these committees that they meet regularly as long as they get support from the project or any other agencies. But we have seen in many cases that either they reduce the frequency or discontinue this meeting after the project ends. So basically, I'm not basically aware about the trend in Myanmar, the practice in Myanmar, but Nayan could share if you have any plan strategies for the continuation of these meetings in future, even in without project support. I mean, it's good to know from Nayan, if you have any strategy in mind,
Thanks, Prakash, for your question. So far, even we are doing the meeting with the WASH FIT committee, we don't support anything. We are just facilitating the meeting for the continuation or implementation of the WASH FIT plan or HCF. So for the to make sure WASH committee members regularly meet beyond the projects and up. So far we don't have any plan how to track or how to monitor. Are they regularly meeting? Are they have regular meeting on the WASH in the HCF or? So I think it's depend on the interest of the HCF in charge. If she understood clearly on the WASH FIT and the importance of WASH in HCF, for sure she or he will organize to have regular meetings. So we need to mobilize and encourage and have center in charge to have regular meeting. So I think that should be the way to have the regular meeting among the WASH committee members.
Thank you, Neong. That's a good insight on where to target the effort. Prakash or others, do you have an answer or some thoughts on how to sustain the committee? It's a perennial question. We get it for whatever kind of project you're in, but in particular for the healthcare facility.
If I can come in, John, for a quick remark on that.
Sure.
So yes, I mean, based on my experience, I think when in your presentation initially you mentioned about dreaming a ambitious thing. So I think sustainability nowadays in the world, for a long-term sustainability for everything we do, is a kind of dream as well. But I think that dream is very important to see, and at the same time then start putting all those requirements in the place so that the sustainability would ensure. So like one of the things we'll have to mention, the critical factor here is that how best and how regularly we engage all the stakeholders who has the stake in this project. So who has a role of asking or demanding that service from the government, who has a kind of reach at the state government or national government to speak about that, and also who has at the facility level to act on that. So now when we do the annual monitoring, I think we have to think about a next step of that annual monitoring that also you mentioned, John, as an example in some African countries, that the reflection, the collective reflection on that monitoring findings. So, and that has to happen with all the stakeholders together. And that is the platform where you can present the picture of the continuous improvement or the things that is not working, even we are trying due to the lack of participation or support from somebody, so that this is the platform you get everyone to redefine your strategy or improve the strategy and make the government authority, which means could be a different authorities as well at that geography, so that they put that system and process in place to continue reflecting on the progress. This is one. The another is I think in our project, one of the component we missed out, which is again very critical for sustainability, is that we are talking about providing drinking water services or drinking water in terms of quantity and quality. But when it comes to the sustainability of source, there is a question perhaps we are not doing much. And I think that is what should also be considered if we cannot invest for contributing the source sustainability. Then we have to make sure that the government authority or other concerned department within the government system will consider that factor and make necessary investment so that the source also sustain. Thank you.
Thanks for those insights, Satya. Very valuable. So what do we do with the annual data aside from our own reporting? Let's use it. Let's really see how far we can use that as a dialogue piece and to see where that can take us, not only in sustaining the committees and the committee activity, but also getting the necessary investment. Thanks a lot. We've had a lot of great input from Asia. I'd like to shift over to Africa, some questions that are coming in. Tigist, you had a couple questions already in the chat, some comments. Maybe some of those were addressed, but please invite you to come on and ask what's most relevant if that's all right.
Yes, I had a couple of questions, but I think they are addressed during the discussions, and I'm fine with that, John.
Okay, sure, great, yep. And there was another one from Resham. There may be developed implementation guideline for WASH and healthcare facilities. Can we also get that along with this presentation, please? Yes, absolutely. We'll get the presentation, some of the other tools that were mentioned, and also the link to the WASH FIT. And if we have any other examples of contextualization of WASH FIT to a country context, we can also make that available. But actually, this discussion is so rich. I think what would be great is if the consortium management unit works to capture some of the main points and features that are coming out of this discussion, we can document that, some of the ideas, and then maybe even take that forward in the future where we see we need to develop more aspects within this community of practice. So yes, we'll do that for sure. Rasham, was there anything else you'd like to comment on, or?
No. I have no more comments.
Okay, great, thank you. Siddiqui, you give a description of quite a significant operation in Cox's Bazar. Would you like to come on and kind of share your experience and kind of where you're at with the WASH FIT process, or what you're thinking about it if you're not already implementing it? Are you able to unmute? Oh, I'm not sure. Maybe you dropped off. I don't see you anymore. Maybe that's why. Okay, so Siddiqui was saying that they have, they're implementing WASH and healthcare facilities around the Rohingya camps, and they're covering 150. That's quite significant. So maybe WASH and healthcare facilities in emergency settings and camp settings is a future topic that we could take up within this community of practice.
Hi, John. This is Shahid.
Shahid, yes. You know something about this.
Well, Siddiqui is sitting next to my room. I don't know whether he's still available or not. So he's working in my team.
Great. And Shahid, of course, before you joined HEX, you were active with Terre doing WASH and healthcare facilities in Bangladesh. So please, your thoughts, insights, and any questions you may have.
Well, actually, we are implementing now WASH FIT projects funded by WHO and SDC, and that's what Siddiqui mentioned here, that we have quite a big number of facilities that we are working with. So WHO part is only software part, and for SDC we are also providing some hardware facilities, like rehabilitation of WASH facilities, not the entire renovation work for the building, but only trying to functioning all the WASH facilities. So now, what is very important, maybe just to quickly share that, yeah, when it comes to government facilities, of course, then the rehabilitation budget is matter, because very often they just simply refer, I mean, the government staff members, they just simply refer that I mean, we don't have any funding access. So even if they develop any improvement plan, still it's very difficult to implement. But at the same time, when we talk about the NGO run facilities, sorry, then it's very easy for them, because basically especially in the Rohingya camp in Cox's Bazar, the organizations are looking for this assessment. So once we complete the WASH FIT assessment by the HEX team members, so that's very important for the decision makers in that agencies, so that they can take action for further improvement. So it's very easy for them. So now what we are lacking here is a kind of advocacy platform, because we saw also kind of like WASH in healthcare facilities is not part of the WASH sector, and it's not also part of the health sector. Sometimes we saw kind of this kind of misunderstanding. But anyway, now it belongs to health sector under the health sector leadership, and we are in process of developing an advocacy platform what the platform incorporating all the WASH in healthcare facilities actors. Those are working in this area. But still, the modality, we are not very much sure about the modality, how to develop or how to manage this, how to make it sustainable. So funding is not a matter for this advocacy platform because it's not expensive, but still this operational modality is very important. So the reason why Siddiqui was asking that if any organization or if consortium already developed something that can be shared with us as well, or can we also join in developing these tools or documents? Thank you, John.
Thank you, Sahid. I think just a quick reflection and sharing my learnings with you so that you can, I think, I don't know how far this is relevant to Bangladesh, but in case of India, when we talk about advocacy, and the success of any advocacy initiatives that I have seen is very much dependent on who are the frontliner of your advocacy initiative. So there, I think one of the critical factors is that whether the government, the local government representative or the local government authority are in the frontliner or not. So now, if you have to advocate and convince the district authority or the state authority for applications or earmarking some funding that is needed to address the crisis, then it's very important that we build the capacity and bring the local government authority as part of our frontliner in this advocacy authority. So that the government, so we have to actually think, I think would be good if we think it differently, like advocacy between the government department, between the government authority. So one government authority who is operating at the local level and grassroots level, who is actually from a demanding side, and the other is from a providing side. So if the demanding side is very well capacitated and very well informed about the needs and why they need that, and if they are running your advocacy initiative as a driver, then I think the success of advocacy initiative is quite easy and could be quite successful. Thank you.
Thank you very much, both Shahid and Satya, for that exchange. Always good ideas that are coming up. So it looks like we not only have WASH in emergencies, but also advocacy. I mean, we could develop this community of practice in future info sessions and really deep dive into some of these, and we can co-create these sessions together. This is a bit of a dream to see from my side, but I think it could happen. There are a few other comments and questions I'd like to come to. So there's Raj Kumar in Nepal, and also Kamal from SRC in Nepal. So Raj Kumar, would you like to come on and make your comment?
Yes, thank you very much, John.
Sure.
And I would like to provide many thanks to Neng for this good sharing. And Neng, while listening your experience, I knew that many interventions have been implemented in joint coordination with the different stakeholders, including government. Just, I would like to know now, is there any mechanism of doing or making formal agreement or MOU among those different stakeholders, including government in local level? I mean, defining the roles and responsibilities of all different stakeholders in the return form. Is there any mechanism? Just, I would like to know. Thank you, John.
Thank you. Excellent question. Neong, any thoughts?
For Myanmar, we have MOU with MOHS, Ministry of Health and Sport, for the implementation of health, wash, and nutrition for the township, for Wash Landa Township. So we already have the MOU with MOHS, and then using the MOU, we advocate and introduce the WASH FIT and project about the project at the regional level and the township level. So that MOU is for the township. That is agree and the MOHS and the DDH organization. Yeah.
And if we take TDH out of the picture, and we look at an MOU which is between those government authorities, that between them, if there are some agreements on responsibilities and roles and resources and allocation and coordination mechanisms, could that be something to envisage, really focused on WASH and healthcare facilities? I think that was the idea that came just now from Raj.
In our MOU, we are not specifically mentioned detail about the WASH process. We just mentioned about the WASH healthcare facility and our approach that we're doing in our project area. So I think we might need to go and organize a workshop, national level workshop with the national level elements and the workshop from the different organization for the adoption of, for the official adoption of the WASH FIT national level.
And yeah, and see maybe how to have the roles and responsibilities for promoting that and supporting that institutionalized within the different stakeholders, and also drawing back on Satya's idea that it could be some of the local governments who are demanding that this happen because they've seen the difference that WASH FIT is making, and they'd like to make it more institutionalized and not just dependent on a project which is time bound. So yeah, so maybe we could look at how to do that.
Yeah.
Okay, great. Raj Kumar, anything else?
No, it's okay. It's okay, John. Thank you very much.
Thanks for that question. And Kamal from SRC, about asking a question about risks for continuity.
Yes, John. What we have actually seen, we also practiced in the past going with the good initiative. Everybody liked it, and we have seen that they are there until we are there, and after that it is vanished. And later we realized, actually, while working with the health facility, we started to work together with the existing health committees. We call HCF OMC, and if we form committees like WASH FIT committee, it looks that it is not something that is already into the government system, and usually what happens is that if there is new authority there for the main committees, or if there is a new staff member, senior staff member who takes decision is a new one, after a while, then these initiatives, though they are very effective, they do not give much priority. So I was actually worried a little bit, if this is not the officially recognized committee, possibly we should have gone with the main committee, not calling it WASH FIT, but possibly the health facility management committee, who actually deals with this WASH FIT as well. And they might have more authorities to take decision on resources also, and also to decide the continuity mechanism. On that part, I was a little bit, interested to know. But of course, in length, actually, sustainability related topics will be discussed possibly. It is okay for the time being. John, over to you.
Thanks a lot. Thanks a lot for that input. And with the idea that Lakshman put forward earlier, that could be an opportunity to better institutionalize WASH FIT. But I fully agree with you. We don't have to call it WASH FIT. It doesn't have to be. It could be a process similar to WASH FIT, which is adapted to that context. So yeah, this it looks like there's some opportunities in Nepal to take this forward. I'm just scanning the questions. I might not have gotten them all. I might have missed a couple. Would anyone like to come on, ask a question, or even make a few remarks like the colleagues have just done? Excellent remarks on what they've heard, what's resonating, what we need to watch out for.
John, this is Ramesh.
Yes, Ramesh, please.
Yeah, in fact, I wanted to add a few points regarding governance. We can say it to WASH governance. Whenever we talk about, let's say, the sustainability, overall sustainability, there are 4 main governing points, 4 main areas in WASH. So we can say 4 dimensions. So one could be, we can say it as a dimension, institutional dimension, cost recovery, or let's say financial dimension, and then technical dimension. So we can somehow sum up the overall sustainability in these 4 areas. Now here we are talking about the institution. We also touched upon the part, cost, how to arrange the O&M. So this point also we touched upon. Basically, what I want to refer here is the institutional aspect, because that is the governance. So, rightly said by or till and until there is involvement of local government bodies, we say involvement, not only like in during planning or even execution, but we expect basically also in terms of, so that is a full-fledged sort of involvement. Therefore, to make a project in real sense sustainable, the local government always take the lead, whether it is a SCF or school or community level, whatever it is, WASH. So to make WASH sustainable, local governments should be always in forefront and taking lead. Therefore, I think Rajkumarji was indicating to us that is there any sort of formal MOU made with local government institution? I think that was we have lots of experience, basically, some good experiences, some good experiences, many from Nepal and from other parts of the world. But the thing is, institutional aspect plays really a vital role. Therefore, whenever we think or we dream about long-term overall sustainability, really we have to give very much and a focus on what's recovery is there. Meantime, to make a good governance in WASH, to ensure good governance in WASH, we have to more focus on institutional aspect also. That's what I want.
Excellent. Excellent. Thank you very much. Thank you very much, Ramesh. Very useful, and I echo those comments. And I think that this is the way, the direction that the group right now on the call is heading in. We've got this WASH FIT tool. We've talked about it, but we're very quickly zoomed out and looked at the bigger picture. And I really like the progression of this discussion. I see there's a couple new comments at the bottom. Resham is asking if there's any experience of a demand for such a project from any nearby healthcare facilities who maybe weren't included in your project, but they're looking for the positive changes. So they've somehow been exposed to it and they say, wow, we would like to get that WASH FIT. So I think that's the gist of the question. Is that right, Resham?
Yes, sir, yes.
Yes, Neon, we can hear you.
Yeah. So far, the TMO, I mean the TMO Township Medical Officer from the nearby township, Shwebita, she know the situation about the project that we are implementing in line there, because the TMO, both TMO know each other. They met at the regional level meeting, so they share the experience on about our project that implemented in line there using WASH FIT. So the TMO of the Shwebita request as our project should be the dump sheet. So we are now starting the another WASH project in the Shwebita using the WASH FIT 2. But we plan to use the WASH FIT 2 because of the COVID, we cannot do properly about the WASH FIT process and the Shwebita dump sheets now. So this is the one of the experience that we got from the Shwebita dump sheet so far.
It's a good example, working with the township medical officer, but then they also have a dialogue between townships about what's happening, and that's a really great sign to see if there's buy-in and there's demand for it from that area. Excellent. Okay, great. So we're coming on, about 5-10 minutes left, and why just maybe we could jump forward and see how to shape this community of practice, if that's all right. I'd like to again thank Naon and also all of you for these inputs that we've had on WASH FIT and the broader question on working within the health system and working to promote local governance, advocacy. I think these are the real core issues that we have to be looking at as responsible sustainable development actors and contributors. So let's see if I can just go to the next slide. There are references that will be in this presentation. I'm just gonna I'll leave them there just for a moment, but you can obviously explore these as well as the link for the WASH FIT manual. I propose that we look at the Soapbox Teach Clean package at a future meeting, because with the time we have remaining, I'd like to get your input on where to take our collaboration. So if having this kind of a meeting is useful, what would be your expectations for the output of this meeting and for any such future meetings? And are there any specific consortium projects that would like to raise their hand now and say, we need support and in this specific area? And then we can see as a community of practice within the consortium, how to provide that support and start to interact a little bit more. So the floor is open. Who would like to comment? If you just want to raise your hands or write something in the chat box and we'll call on you. Okay, maybe we'll start with a simple question. What would you like to see coming out of this meeting? And should there be a next meeting? And what might that focus on? Prakash, you have your hand up, but I don't know if that's from previous time. So Satya is saying a broad sustainability, how and what to achieve this, what to do to achieve the sustainability in Washington healthcare facilities. Thank you, Satya.
Yes, I agree with you with the Satya. We need to develop the sustainability of FACET strategy for our WASH project, how to successfully hand over it to the WASH committee and HCF. Maybe also to the local health authority.
And also one more point is that what is our strategy to go to scale? Are we very clear about pushing our model at scale, and what are the things we need to make sure in place so that we can go smoothly at scale, and what are the kind of a milestone for us to go to scale, and all those things I think also we should discuss. Is that what does it mean when we say going scale after this model development?
Great, thank you for that. Others? Annette, probably a gender and diversity approach is already there, but making it more visible and putting it more in the forefront would be good. Thank you very much.
I mean, in order to, I think one of the discussions would be great, John and Ramesh, to have on how best our consortium project align with the principles and taglines of the SDGs, like leaving no one behind is one. Whether when we talk about the WASH in HCF projects, are we covering the most vulnerable HCF, or the most which might not have, which might not fulfill all the criteria to be selected. But then the question would come is whether we are reaching the most vulnerable or the last mile.
Thanks for that.
Discuss it.
That's very, very important area. Of course, I mean, we have to take into account, and this is always a common question that you see organizations encounter.
Yes, I think when, I mean, nowadays, Ramesh, yes, very good. I mean, nowadays, one of the things now the practitioners, the global community of practice would like to invest for is the low hanging or middle hanging fruit. So they do not actually want to go to the high hanging. But,
yes.
but the most demanding or most needy or poorest of the poor or most vulnerable section is actually very high hanging, which is very difficult to reach, and which might not fulfill all the criteria or many other things. But now the questions to us is then how far we are making ourselves accountable and responsible to reach out that last mile.
We have to be careful while developing criteria, you know.
Yeah.
So this all comes under step by step. So the very first step is how and where to select, and whom to select. So that's basically from there, and that is very important point. Very, 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 very.
Great. So we will we'll take a look at these ideas, and Prakash has said future topic: advocacy on WASH and sustainability within countries or at a global level or locally. Great. And Tulasa, what about involvement of WHO, UNICEF, and such sharing? Is there a very influencing partner for the Ministry of Health? Acceptance of the approach and sustainability. Excellent point. The key to Terre des Hommes in Bangladesh, getting that national level exposure and conference and starting a task team, a country level task team, was a conversation that Terre des Hommes had with WHO, who then contacted the Ministry of Health and then contacted UNICEF, and then it started to go from there. So very good point on that. I think we have a range of points that we can build on. We can summarize this discussion. This isn't going to be the only discussion. There'll be another meeting with with our Francophone colleagues in West Africa and also Madagascar. We'll be going through the same presentation. They'll also be ideating on the same questions that we are. And so then the consortium management will put this forward and will propose maybe one or two next steps that we could take forward in a periodic meeting. If I could just request in this last minute, if anyone has, two things. One, if you are from a project or from a team which has limited experience with WASH and healthcare facilities, and you would like some support either from the consortium management unit or other projects in the region, please, you can write it in the chat room, or you can write to myself or Ramesh or on this call, and we'll see how we can best support you. Whether or not you are a consortium project in phase 3 or not, I think this community of practice, it's all in our advantage to work together on this. And the second point is who would be interested in coming back and having another meeting in 1 month, 6 weeks, 2 months to take this forward? What would be your vote? after what period of time we would get back together and discuss the next aspect or the next step in a 1.5 hour webinar like this, for example.
John?
Yes?
You're asking a couple of questions here. Is there a way, you know, maybe that to present them in a different way, or that we can think about it, or, you know, with, for example, the Swiss Red Cross, that we have a little bit a clearer idea? Can we get back to you maybe on this? For me, it seems there are several questions here which we need to think about maybe a little bit. Over.
Thank you, Annette. Yes, first question is, if you need specific support to start implementing a WASH in healthcare facilities project, or with a specific aspect of your ongoing project, please write to us, myself, or to Ramesh, the regional advisor in Asia, and we can start a dialogue on that. And the second question is, if we were going to have a community of practice meeting like this on a webinar format for maybe, you know, 1.5 hours, how often would you be interested in joining something like that? So we have Tigis saying maybe once a month would be good. Raj Kumar, interval of every 2 months. Satya, once a month. Okay, Shahid, once a month. So, okay, now, thank you very much, Annette, for helping me to clarify the question, because that got the some of the responses coming. And for the others, for the broader questions on support you may need, please definitely reach out to us at any time. Great, so with that, I'd like to thank everyone. Again, real special thanks to Neong and the Tourism Myanmar team, and Lakshman also, who contributed to preparing their presentation. It was really, really good to be able to do a deep dive into your project and to see the learning and the reflections that came out of that. And I think you also got some good input from our colleagues who are seasoned in the field. Thanks everyone, and have an excellent week, and we'll be in touch with you soon.
Thanks, John, and everyone.
Thank you.
Bye.
Thank you so much.